Hello, my name is Josh Kane. Today, we're going to be reviewing how to find a missing study within Synchronicity. This missing study could be one that you performed on the machine signed and submitted where you didn't put in patient information, your operator information might be missing, or a study was performed in an emergent situation and no information was logged on the study, but it was still uploaded to Synchronicity. To begin, let's log into Synchronicity. You may do so by navigating using the links within Cerner or going directly to the IU Health Synchronicity website. In this first example, it'll be a study that you put your username on, but didn't put any information in. It'll load here in your Recent Studies tab with an unknown identifier. You can click on the study, you'll see that you're assigned to it. At the top of the screen, you'll see that it's an unknown patient ID. You can click on the Edit tab. From here, go to the patient ID space and type in their medical record number. If you're doing this while the patient is still in your department, or if you're doing it shortly after they are discharged, it should automatically pull up patient information including name and encounter number, which is the FIN. If not, type in the medical record number, first name and last name, and that should be sufficient. Afterwards, select your worksheet and exam type, complete the worksheet as normal, and click Sign and Submit. In this next example, we're going to look at what happens when you type in patient's name and information but forget to put your name on the study as an operator. Today's patient is named I Forgot, and you'll notice that it's not here in the Recent Studies tab. In order to locate this patient, click on the All Studies tab to the right, which will pull up the list of all studies uploaded in Synchronicity. You can scroll through this list, which is sorted by most recent, and identify your patient name from the list. Once you've located the study and clicked on it to open it, you'll see here that underperforming is listed as unassigned. Once you click on Assign, a pop-up box should appear, giving you two options. The first is to assign yourself to the study. You may click this and click Assign. Alternatively, you can use the second option to assign another operator to the study. This will allow you to put the study in the resident's work queue or assign it to another physician for final signature. Once you've done this, go ahead, select your exam type and worksheet, and complete the workflow as normal, making sure to click Sign and Submit. The final case we're going to look at today is what to do if you perform a study but forget to attach any patient information or your name as operator. Typically, this will happen in an emergency setting. It's best to complete this step shortly after performing the study. Go ahead and log into Synchronicity, and from the landing page, click on All Studies to the right. You'll see here in the list of recently performed studies, there's an unknown study without a medical record number and no operator assigned to it. Based on the timestamp, this is the study that was recently performed and likely lines up with what you've done. Click on the study, open it, and review the images, making sure that this is in fact the study you performed and matches up with the appropriate patient. From there, assign yourself to the study, that way you can modify it. Then go to the top tab and edit the patient information, putting in the requisite MRN, first name, last name, and hopefully these fields will auto-populate as the system will recognize an active MRN from the hospital work list. From there, you may proceed as normal in filling out the worksheet.